So I'm going to switch gears, sort of big time, to a different population, different approaches. I think one of the things I have learned about working in this field is that we need a lot of different approaches, and what works for urban violence is not what's going to work in rural Colorado for, you know, ranchers who are thinking of suicide. And we can all work in this space without stepping on each other's toes, and I think that that's important. So to switch gears is not to negate anything that anyone else has said, but just to think about when different populations are going to need different things. So I really like this video that I want to start with. This was done by, oh, apparently I don't know how to use Max. Oh, geez. Oh, no, stop it. Okay. This is, stop. Okay. I'm clearly a PC user.
Yeah, no, definitely a Mac user. Hang on.
So this was, this video was created by the Utah Suicide Prevention Council.
I don't know how to make this sound. That's going to be the problem.
Oh.
Hang on, let me see if we can.
It's okay. It's only like 20 seconds. I want you to just like watch it. I'm going to tell you what he says, and
Okay.
you can look it up later. But this is like the poster child. So he takes off his things, and he's like, a while back, I was going through a rough time, and some of my buddies came over and told me they wanted to hang on to my guns for a while. And basically, I think they saved my life. He says more, clearly, because that took longer. But you get the idea, and then there's like a voiceover saying, if you're worried about somebody, hang on to their guns. And this is part of this safety campaign that they have, that the tagline is on it, is your safety on. And so I'll send out the link to that, but I really like that because I feel like it is, again, the poster child of who we're thinking about with firearm suicide prevention. And to me, it also really echoes the importance of using trusted messengers for this kind of work. So I want to talk a little bit about firearm suicide prevention and the link there and why it's important that we think about the two things together. I think, as Megan talked about in her first story, as ER providers, we don't see firearm suicide victims because they don't make it to us. And so I think we have a really skewed view of who firearm violence victims are. But when I talk about firearm violence, I include self-inflicted violence, so I include suicide in that. But we know from prior research that when you look at all people who have had ideation or even suicide attempts, only 10% later die. So that's actually like a much better prognosis than a lot of the diseases we deal with. I think it's hard because we all know, I'm pretty sure this is true across the US, there's a lot of recidivism, right, among patients who have especially overlapping substance use and social issues and suicide ideation. The ones who are really struggling come back over and over and over again. And so I think we can start to feel like it's hopeless. But in fact, the people who go on and thrive don't come back. And so we don't hear those success stories. So it's important for us to remember that overall, most people get through their crisis and go on to hopefully heal and get back to a happy life. But we know when we think about methods, so case fatality rates, firearms are by far the highest. Probably 85–90% of people who attempt with a gun will die because guns are intended to be lethal. And so if aimed at the right body part, usually will result in death. And like I said before, most of those people don't make it to the ER. So we don't see them, and so we don't think about them. When you look at suicide methods in the US, so this is CDC data looking at among all suicide deaths, what they're from. So 50% of all suicides in the US are by firearm, followed by suffocation, which is hanging, certainly a big concern as well, and then poisoning. And you can see jumping off of things, cutting, other like running in front of cars, much lower. So firearms account for the largest number of suicides in the US. When we look at non-fatal attempts, this is what we see in the ER, right? It's almost all medication overdoses and cutting. And we know that a lot of those medication overdoses are non-toxic drugs or non-toxic amounts. And so we watch them, we get them through that, and then hopefully get them the mental health treatment that we need. But you can see there's only a tiny, tiny sliver of firearms, right? Okay. So the third thing you need to know is that when we think about suicide, people sometimes refer to it as impulsive. It's a word I'm trying to get away from now because that sort of implies like you were just like walking down the street and like an impulse buy. You're like, I think I'll kill myself. Like that's not really what we mean. what it is that we know that there's usually some context of confluence of factors. There's whether it's underlying mental illness, substance abuse, social stressors, loss of a job, breakup of a relationship. All those things come together. But then we know from research that there's often a very short time, in the space of minutes to hours, from when someone decides to attempt suicide to actually taking action. And so that's what people mean when they refer to suicide as impulsive. So the point of this is that there's often a short window, maybe up to 1 to 2 days, that you need to keep people sort of protected during. And then usually if people get through that window, they're going to be okay. So this is important because when we talk about firearm safety and lethal means counseling, as it's called, that awesome guy with the gun who you couldn't hear, the point he's getting at is that it's temporary. He was going through a rough patch. His buddies stepped in to help him, and now he's back at the range. And that's a really important message. So we know there's been a ton of research. I'm not going to bore you, hopefully. But what we know is that where there are more guns, there are more suicides. And part of the reason the United States has a high suicide rate is because of availability of guns. This is true when we look at state-level studies, and state suicide rates are better explained by access to firearms than even other things like access to mental health, underlying mental health problems, frequency of ideation, and so forth. We know that overall a firearm in the home increases the risk of suicide, completed suicide, by about 3 times. Also put in a little plug here. Please erase from your vocabulary successful suicide. It's not a success when you die. So completed suicide. And then we also know that adults who are in households with firearms are more likely to die by suicide, but this is really important. They are not more likely to be depressed or suicidal or have mental illness. So the gun does not trigger the suicidal thoughts. It's not that people who own guns are more likely to have suicidal thoughts. It's that in the moment, if they are able to access a firearm, they're more likely to die because the gun is more lethal, right? So again, it's not that buying a gun makes you contemplate killing yourself in the future. It's really around access during that window of risk. So when we talk to patients, or the community, or legislators, or research studies, or whatever, but especially when we're talking to patients, the message here is about reducing access for those at risk. And I put this picture up because it's exactly like having a designated driver. So if you are out with your buddies on a Saturday night and one of them has too much to drink, hopefully you don't call the police to take away his license, because that would make you a terrible friend if that was your first action, right? No, of course not. You take his car keys, you get him an Uber, you drive him home, whatever. Like, you help him out to get him until he's safe again to drive. And it's exactly the same thing what we're talking about with firearms. It gets tricky because of laws, et cetera, but the point is the same. The first instinct should not be to call the police. It's about storing firearms either safely in the home, locked up so the person at risk can't access them, so somebody else has the key, somebody else has the passcode, or storing them outside of the home. And we can talk about, it could be at gun shops, trusted individuals, depending on state laws, or law enforcement. I'll just make a comment here about red flag laws, because I think there's been a lot of discussion about this, and I tend to not work in the policy space for maybe obvious reasons. I think a lot of this is about collaboration and communication, and policy is not always the solution. Who lives in a state with a red flag law? We have one. Who knows what? Yeah, I'm going to explain what they are. So red flag laws are also known as extreme risk protection orders or gun violence restraining orders, and they allow family members or law enforcement to petition the court to have someone's firearms temporarily taken away, usually for 2 weeks. The petitioner has to prove that the person is at imminent risk of hurting themselves or someone else. There's a hearing before a judge. In some states, like in my state, and we could talk about this offline, it's like incredibly controversial and has been a sort of fascinating discussion. My point on these is that I think that they have merit for rare cases. They hopefully don't need to be used much, but when you know that somebody's about to do a mass shooting, like, of course law enforcement should be able to step in. When we're talking about suicide risk, I don't think they're the first thing people are going to go for, because you want the trusted community around them, again, to first be stepping in and doing sort of voluntary actions, engaging the suicidal person. So instead of saying, I'm calling the police to take away your guns, again, it's how can we talk about making your home safer, engaging the person in that conversation. Okay. I also wanted to talk just briefly about some of the sort of community-facing partnerships that I think are a really phenomenal way to get involved in this space depending on your own interests as a professional. This has been the most interesting part of my career over the past couple of years. I think they also really inform our work as healthcare providers, and so just to plant the seed in terms of what we have learned from them, but also how they can potentially enhance your own career. So, gosh, it was almost now 10 years ago probably in New Hampshire, the New Hampshire Firearm Safety Coalition began. It was started after a gun shop owner learned that 3 people who had bought guns from his shop had killed themselves. And he was personally really upset by it. But like, that is not why he sells guns. That is not their intent. You know, he doesn't want people killed with the guns that he sells and so forth. And so he partnered with people from the School of Public Health at Harvard, as well as others in the area. And they've formed a group that met to talk about how can we help prevent firearm suicide. They developed, this is an example of one of the posters that they visited all the shops in New Hampshire, the gun shops in New Hampshire, and said, hey, can you put up posters? You want to hear some brochures? There's a thing when you buy a new firearm, like a brochure that was like the 10 commandments of gun safety. They added an 11th commandment, which is when someone in your home is at risk, lock up the guns. And they did a program. They've published 1 or 2 papers from it. It's hard to know what the effect of these programs are because like it's just a really hard thing to measure. But when they went back, they did find that a lot of shops were still displaying the materials at least. And what has happened since is the program has spread all over. I'm very proud that in Colorado, we have a coalition that is supporting our state project. So in Colorado, it's actually run through our Department of Public Health and Environment, and I learned yesterday that they're hoping to go statewide next year. They're currently in 100 gun shops in like 21 counties in Colorado, but hoping to expand. And we're doing a project with the Department of Defense right now, looking at all these projects and how they're different. They're very organic, so in some places it's like 2 volunteers covering the whole states. In some, like Colorado, it's a more official infrastructure where there's some state funding. And the DoD is interested in basically how to encourage shops to partner with bases to try to tackle this angle of military suicide. So lots of big groups getting on board with these kinds of things. And as I said, it's really hard to measure the impact, but I think at a personal level, the impact of the conversations and the partnerships is, like the commercial, is priceless. I mean, yesterday we had our coalition meeting yesterday and talking with some folks ranging from internists who have pretty, I think, views in support of gun control to some folks who own big stores in Denver. And we were able to just have a really open, respectful conversation around things like ERPOs and child access prevention laws and learning from each other and thinking about what we could do together. And in this day and age, when I feel very divisive, it's especially nice to find those ways to partner and listen to people. And so some of the other things I'll just mention that like our program has done, Will helped us out a year ago, I think. We held an event sort of like this, but for faculty in our department to come to the range. It was like a 2-hour sort of didactics about how to talk to patients, and then we had local law enforcement come to show us some of their non-lethal methods. They have like the beanbag guns, which are really crazy, and then people could go into the range to shoot. And one of my dear friends came, had never touched a gun before. She came in her Black Lives Matter t-shirt with like all of her buttons, and it was awesome. She came into the store, she talked to people, and it was like just a wonderful thing to see people kind of expanding their ideas. We've done some events at Ladies' Night, like suicide prevention at Ladies' Night at the Gun Club, talking to women about suicide prevention for teens. And different programs, like in California, one of them is partnering with Alzheimer's San Diego to do dementia-focused work. Something else my research group is working on. So thinking about how do we, again, get these suicide prevention messages, safe storage messages to the communities who need them. I think that often can be from us as healthcare providers when we have a chance to act, but can also come from other settings. some other examples at the national level, the American Foundation for Suicide Prevention has partnered with the National Shooting Sports Foundation, which is the trade association for the firearms industry. This is one of their brochures. They basically now have the gun shop program brochures that they've distributed to all 10,000 shops who are their members. This on the right, that's an example from the Navy from last fall, I think. Again, really owning this connection between firearms and suicide. I think it's really important for us as clinicians to remember that locking up the guns alone does not get rid of the suicide problem. Like, of course, people still need connection to whatever resources they need, to mental health care and so forth, but it's an important, important step in that process. There are some great PSAs out there. This is the one on the bottom is the one I showed. The suicide prevention training on the right is one, and are we going to send slides? I think so, if people want. But this is an example from the Utah Firearm Safety Suicide Prevention Training. So for those of you interested in education, this is one example of something that's out there. It's like 5 minutes long, and it's basically him showing how to use different gun locks. So I think can be helpful for people who are totally unfamiliar, who want to learn a little bit more about what the storage options are. This top one is from the VA. So I know Jeremy is going to talk, I think, in more detail about safe storage options. Got it. Okay. So actually then I'm going to take a minute to talk a little bit about that. I don't have a slide. Sorry for the miscommunication. So, but to bring back a little bit to what it is that we are talking about when we're working with patients, because I glossed over this a little bit. So it's not confiscating guns. It's not calling your local police department to come take somebody's guns away. But if you have somebody who you are taking care of in the ER who is suicidal, their access to lethal means is important. So, and we're actually trying to kind of map when in our workflow this happens, because I think it's a biphasic thing. I think we often, if we think about asking about access to lethal means, ask during our initial risk assessment. So how many people here work in a place that has like mental health consultants easily accessible? Yeah. So like about half, which is kind of, yeah, it depends on the. So I think for many of us, though, access to lethal means will factor into our risk assessment. I had a colleague once, I'm very touched that more and more people in my shop are asking about firearms because they're sick of hearing me like harp about it. But they came running over and they were like, oh my God, this guy has some passive suicidal ideation, but he also has a gun at home. Does that mean I have to admit him to a hospital? And I was like, good question. No. So the next piece is you need to figure out the plan of what they're going to do with the means. But certainly, if you know somebody has access to every kind of lethal means, they're not willing to safety plan, that might push you more towards being concerned about them, right? Like hopefully, as clinicians, that makes sense. When we're asking people about lethal means, it's not just firearms. Of course, we should think about medications and other things as well. And if somebody has a plan, for example, to jump off a high building, you might ask, have you thought about which high building? Like, right, okay, I'm not going to do like suicide risk assessment 101 here, but of course we sometimes think about the specific plan and how it relates. But we know that from prior work, somewhere between 20 to 50% of suicidal patients have documentation that somebody asked about firearms or lethal means. So we have a ways to go, because that should really be up at 100%. So, okay, we often ask during the risk assessment, and then you might factor that into your overall global assessment, whether you're doing it yourself or you're having your mental health consultant do it, to decide if the person needs to be admitted to the hospital or to a psych hospital. But then the other time when it's probably even more important is discharge planning. So for patients who are going home, lethal means counseling is super important. It doesn't replace the follow-up appointment, the connection to care, all the other stuff they need, but you want to incorporate it into your standard practice. And basically what it is thinking about what they have access to, and then what can they do to reduce it. So probably the two big ones are medications and firearms. Hanging supplies, really hard to get rid of them all, right, because there's stuff everywhere. Other home hazards, right. So you can't get rid of everything. Like, we're not, I'll just acknowledge that. So you focus on firearms because they're the most deadly, and if you can, medications because they're the most common. So for firearms, in terms of storing outside of the home, that's the best if you can get guns out of the house. ideally somebody else does this. You don't want the suicidal person going home to like handle them themselves. So ideally you want to say like, hey, do you have a friend or family member who could like help you out with this? We did a survey looking at gun shops and ranges, and just for the newbies in the room. Also, there are no dumb questions. We should have said that at the beginning, like, especially for people who are brand new to this. I have asked so many dumb questions over the year. It's okay. Many firearm stores or shops also are ranges, but not always. Sometimes they're just a shop, or sometimes they're just a range. Many of them provide storage for weapons, but not all. So one tiny thing you could do if you want when you get home is just Google map around your hospital and see if there's a local facility. Call them up and say, hey, do you store firearms? At some places, they require a background check to make either when you go to get the gun back. Because if it's a full transfer, in some states, then when the person gets the gun back, they have to fill out paperwork, which you could argue is maybe not a big deal, but like for some people that's going to feel emotionally and logistically like a big hurdle. So when we did a survey of gun shops in the Mountain West, we found about 50% of them or so were offering storage. Big barriers include liability while actually storing them. So can they do it safely? They're worried about theft. Is it temperature, humidity controlled, and so forth? Just some places say like we're a small mom and pop shop, or we don't offer that. Some, like one of the folks I work with in Denver, has a huge, super fancy store where like all the Broncos hang out, and he has like this amazing storage setup thing, right? Law enforcement, I think most people that is not their first jump to, right? I think it was fair to say that a lot of people who own firearms don't love the idea of the police having them because there's a tension there. Also important to know, not all law enforcement agencies will store weapons. So in our survey, it was about 75% had some similar concerns around liability. Both gun shops and law enforcement agencies were concerned about when are they okay to give it back. So if they're storing a weapon for any reason and the person comes to get it back, how do they know that the person's okay? Should point out, sometimes storage is also offered, like the person's going out of town for 6 months and they're renting their house through VRBO, or, I mean, there are other reasons why people might want to store their weapons off-site. Trusted individuals. So this is where, oh yeah, Lauren.
On that point, if you're on one of those vacation rental sites, is there a way to tell if there's guns in the house?
So good question. Not that I know of. To take a step back, something I usually start with, and I think we've touched on, but the culture of safety and responsibility is huge within the firearm owning community. And so all of the responsible firearm owners I have met take very seriously the principle that unauthorized people should not have access to weapons. And I think that would count if you are leasing your house on VRBO. Like either everything is locked up in a super big safe or it is not in the house. But there are certainly the bad apples who spoil it and et cetera, like don't follow those approaches. So I don't know, check the couch cushions maybe. So no. So then trusted individuals. So this is where ideally, right, it's your buddy taking your car keys when you're drunk. So ideally that would be the easiest thing is to give the guns to your buddy. Okay, who here knows their state background check requirements? Okay, not too many people. So okay, like that is what we expect. So thrilled that the AMA and the American Bar Association are working on a project that hopefully by the end of the year there's going to be a searchable database that will be interpretable for clinicians to know what the relevant state laws are. The reason background checks matter is because if you're in a state with universal background checks, often that means every time a gun is transferred, you have to do a background check on the person who's receiving the gun. So, for example, if you live in Maryland, where every firearm transfer requires a background check, if you're suicidal and you give the gun to your neighbor, technically you need a background check on the neighbor before you transfer the gun. And then when you get it back, you would need a background check again. Background checks cost like, I don't know, $10, $15. Any licensed retailer can do them, so it's not a huge deal. But again, logistically and for some people emotionally, it is a huge deal. The other thing I'll just say about background checks, kind of 101, is that the things that invalidate you from possessing a firearm are like a felony, domestic violence. The mental health piece on there is only court adjudicated, like psychiatric placement, so not the M1 holds that we do in the ER. That does nothing to your ability to possess firearms. And then interestingly, the use of illegal substances, including marijuana, and it says explicitly, even if you live in a state that has legalized or decriminalized marijuana, technically you're not supposed to have guns. So it's good to know what your state law is. In Colorado, we have this weird loophole where you can give it to friends or family with no background checks. There's no paperwork for firearm transfers between family members. You could argue that might be bad for some things like domestic violence, but for suicide prevention, it makes it really easy because I can say to people, do you have a family member who you can give them to get them out of the house? Should also acknowledge when someone is at risk, you do what's right. Like, I mean, I think as physicians, we should not be advocating that people commit felonies. And I think I saw the title of Jeremy's talk coming up, Don't Say Stupid Things or something like that. If you waltz in there and you're like, oh, I mean, just like get it out of the house, just go give it to somebody, responsible firearm owners will know that that might be illegal. And so if you just don't want to sound like a moron, like having a little bit of nuance there, I think can be helpful in saying like, okay, like let's think about what might work for you. And if you don't know, that's fine. And if you're like, I'm not an expert on our state laws, but we can work on this together and so forth. Because it definitely gets messy. But the easiest way to look up in your own state what your background check requirements are and what's required for transfers. And if you have questions at all, we're happy to help with that. Okay, and then locking up at home, I think Jeremy has a little bit on this in terms of safe storage. The take home is there are like so many kinds of locking devices. People can find the one that is right for them. The cable locks that we see a lot of firearm owners don't really like those because you have to unload the gun to put it on, and so in the middle of the night for a burglar, for self-protection, that makes it very clunky. So the middle of the road that many people like more are the lock boxes. They're like that big. You can fit a handgun in them, and you open them with like a key code. And then there are big fancy safes that are super heavy and thousands of dollars. A lot of locks are actually pretty easy to break into. Just know that nothing is foolproof. But really anything that the person is willing to use is a step forward. Right? If they have something unlocked and they're willing to use a locking device, and then they should give the key to somebody else. When is it okay to get it back? I mean, that's thankfully in the ER, we're not the one giving them that advice. It's going to depend on how they're doing and when they're feeling better. And I'll just tell one last story and then I'll open it up for questions. An emergency physician colleague told me a story that, and this is someone who is very, I think would even say is very anti-gun, like really uncomfortable around firearms, like hates them. But a good neighbor, a neighbor friend called her and said, going through a rough patch, can I store my handgun at your house for a while? So she said, like, of course, like you're my neighbor, I will, forget laws. So the gun's in her house and she's feeling like just super uncomfortable. I think it was even locked up, but just the presence of it made her like existentially unhappy. And a day into it, the neighbor's wife called and said to her, I want the gun back. I feel super uncomfortable not having it in my home. Like existentially, it just feels wrong. Like our house doesn't feel safe. And I love that story because I think it really captures that people have very different fundamental cultural views on this. Your job as a physician is not to change somebody's views. It is to be respectful of it. We deal with this all the time in all kinds of things. You are, of course, entitled to your own viewpoints, but we don't bring those into the ER. And you may not understand why somebody feels like they need to have a gun in the nightstand, but if they do, then work with them in a way to make some temporary changes to make things safer, to get them through something. And I think that can be like a hard pill sometimes for us to swallow, and for some people it feels like settling. I've been told by people that they think the work that I'm doing is unethical somehow as a provider, that I'm giving people bad advice. I think this is a harm reduction strategy, that like this is meeting our patients where they're at and finding ways to work with them respectfully. And with that, I will stop and take questions. Yeah.
It's quite interesting as an Australian listening to this conversation, because I think you guys are having the conversation that we had 20 years ago, 25 years ago. And we've done some sort of on-paper calculations, and we have a lot of guns in Australia.
Yeah, I think, so the way I sometimes think about this is we need action at all of the levels, from one-on-one with patients up through public health approaches, and Megan and I and the rest of the crew here do a lot of work advocating for those kinds of approaches, especially advocating for the science to allow us to study those approaches. You also need work across the different kinds of firearm violence. As I mentioned, it's going to take different approaches. So like working with a gun shop is not going to help with a school shooting. We just had one in Colorado last week, and I was talking to my colleagues about it the other day, and you know what, the guns were stolen from a locked cabinet. Like those parents actually had locked them up, and the teenagers were able to get them out. And so it raises all kinds of questions. And so I think to talk about some of these approaches is, you're totally right. Of course we need to be looking at this bigger picture, and how do we as a society find ways to make all of us safer while acknowledging cultural differences, Second Amendment rights, beliefs, and so forth. I don't know what the answer to that is. It's really hard for me. The first step has been trying to truly understand people's divergent viewpoints and like where we find common ground. I think when we think about working with patients, it's important we remember that nobody wants to lose a family member, right? So many people own firearms precisely because they want to protect their families. And so nobody wants to lose someone to suicide or otherwise. And so how do we, as healthcare providers, work in that space to help prevent some of those? And we in suicide prevention, we also need the bigger public health approaches, looking at, isolation in rural areas, connection to mental health resources, the sort of toxic masculinity that makes it so men feel like they can't ask for help. All of those things, of course, we need that as well. And I go to a lot of suicide prevention conferences too, and it's interesting because they're all like, the ER should just screen everyone, and I'm like, no. But you're totally right. And I think the last thing I'll just say is, how do we think about coordinated efforts so that, for example, background check laws, which have a lot of merit, I think, and do a lot of good, but were not written with suicide prevention in mind. And so they have made it harder for us to do what we need to do for suicide prevention. So Washington State is the only one that I know of who actually went back, amended it, put a clause in to make it easier so that there's a temporary removal of the background check when it's for prevention of imminent suicide. Like, how do we do this intelligently so that we're, yeah, please.
There are simple things that we think have made a big impact. So, for example, if somebody, we do background checks on everybody who wants to acquire a firearm or get a license to own a firearm. I don't know whether you have to have a license in the United States to have a firearm, but we do. You have to do a firearm safety course before you can actually use it. We have simple things like we have to lock up all our firearms either on site or at a gun range or so on. But those giant gun safes that we have to use, they don't cost that much. They may cost $200 US. They're compliant, they're difficult to break into. We have things such as you can't just go and buy a gun and take it home. You have to wait 6 weeks before you can actually take the gun. And that's a specific suicide and homicide prevention measure within the public health. So in terms of technology, there are certain types of firearms we can't use. So you remember the mass shooting in New Zealand? That has been illegal in Australia for 20 years, that sort of firearm. So we have limits to the number of bullets in a magazine that you can have and so on. So we've taken a whole bunch of measures to do it.
I think it's also important to recognize that the United States is in a lot of ways real different from Australia or New Zealand. So my sister lives in Switzerland, and there every male of kind of military age owns a firearm, right? And they also go through extensive training. It's totally different. I have very close friends who are Israeli military, but any dishonorably discharged from the Air Force and had domestic violence, felony conviction, child abuse conviction, should never, so there's an enforcement, there's absolutely a policy and enforcement part of it. But if we say that policy alone is going to fix the problems in this country, we're deluding ourselves. For a variety of reasons, both because of the dysfunction of our political system and because of the fact that, again, there are people right now, the Colorado school shooting that happened this weekend, those are just kind of two of many, many examples that would not have been stopped. Like, even if we have the laws in place that are in place in Australia, there are shootings that would not have been stopped. And I think there's like that trope of like, well, urban violence will be stopped by a day in the AR-15s, right? But that's true. Like, most of the gun deaths in this country are handguns. And so I think that we absolutely have to talk about policy, but we as a country, like here, we can't hold, like, we can't get so caught in if only we were like Australia or New Zealand or, you know, or Japan or wherever, that we can't move forward to create, like, we need to create solutions now given what we have, right? And I think there are, you know, the Rand Corporation just did a wonderful review of policy. And there are people doing kind of comparisons of kind of Australia, New Zealand, et cetera, to the United States. I think there's a large role for policy. But again, I think that when we get caught on policy, that's when we know where we are. We're definitely going that really, the death rate, not even absolute, I mean, absolute death rate, I shouldn't do agree, but the death rate when corrected for number of people in the United States has gone from 10 per 100,000 when it first started giving this talk after Sandy Hook to over 12 per 100,000 today. Our death rate is now higher than that of sepsis. It's higher than that of motor vehicle crashes. It's almost equivalent to that of opioids. We're putting $500 billion into opioid research and interventions, which has the same death rate as this, right? And opioids are a great example in the United States of where, like, our laws are the same as England's or Australia's, right? But yet we have 90% of the opioid prescriptions and opioid overdose death rates. And so there's policy, but then there's also kind of the on-the-ground reality. And so in the United States, we're dealing with opioid overdose, not just by laws. We know fentanyl is illegal outside of the hospital, and yet how many of us are taking care of patients every day who are coming in with a fentanyl overdose, right? And so I think that there has to be this kind of multi-level thing. And so I think that your points are really, really important, and I think it's a critical thing to discuss. So I don't think that any of us are saying policy doesn't matter, but rather it is not sufficient. And when we focus exclusively on policy, we fail to treat the problems of the kids that Kat talked about, the suicidal patients that Emmy's talking about, honestly, you know what I mean? Like, would it have stopped the Las Vegas shooting at MGM Grand a year and a half ago? Probably, right? And that's what we're thinking it should be another event. But again, that's 0.5% of deaths in this country. They're horrible, they are infectious, there's like all, you know, again, we could engage in a larger discussion there, but yeah.
I think, can I just add one thing? Because I think that the other reason that I think you may be also responding to, we haven't talked policy much today. Like, we haven't talked about the evidence of which laws may or may not help. And I think part of that is because I think many of us share the view that as clinicians, one of the easier ways for us to get involved is thinking about what we do with the patient right in front of us, and in using our voices as physicians to advocate for things like research and education that are not political. That is not to dissuade anyone from getting involved in policy approaches, but I think this space is one that is easier for us to start to find the collaboration, because I also firmly believe when we are looking at policy solutions, we need to be doing it collaboratively. So the RAND report, which Megan talked about, I really liked that they included things like defensive gun use and participation in hunting as outcomes and cost of firearms to look at a range of outcomes. And the ERPO debate that we just had in Colorado, my summary of it is basically we have a blue House, Senate, and governor, so they pushed through what they wanted. I support ERPOs, but they had the chance, and they actually met with some of our coalition members to get their viewpoints. They could have made some really easy fixes to make everybody happier about the bill, like making the penalties for misuse stronger, for example. So like if you just called your ex-boyfriend because you were mad, like the penalty could be a felony, and instead in Colorado it's like $200. And they chose not to because they were like, we don't need to. And to me, that's an example of like, you just wrote a law that's intended for firearm owners to use, and you pissed off all the firearm owners in doing that. Like, what was the, it's totally dysfunctional.